Hola, ¿qué tal? Muy buenos días a todos. Ya estamos por comenzar esta sesión informativa de la OPS. En unos segundos más comenzamos. Estamos esperando que sigan ingresando todos a la sala y ya estamos comenzando, así que gracias por acompañarnos.
Good morning to all of you. It's a pleasure to have you with us. We are about to start with this press conference here at PAHO. Just give us a couple of minutes. We'll be starting soon.
Bien, ahora sí, entonces.
Okay. So I hope you're hearing us just fine. Good morning and welcome to this weekly press conference by the Pan American Health Organization on the COVID-19 pandemic in the region of the Americas. I'm Sebastián Oliel at the Communications Department at PAHO. We remind you that, as usual, we have interpreting services into English and into Spanish, and you can choose the language by clicking on the globe at the bottom of the screen. This session will be about 45 minutes long, and we will be taking questions up until that time. We have received several questions via email, and you will also be able to ask questions using the Q&A button. We will be giving you the floor, but we would like to kindly ask you to write the question first on the Q&A section so we can coordinate. And you will have to click on the raise your hand button. We would also like to ask you to identify yourself by name and media outlet. This session can also be followed on PAHO social networks on Facebook and Twitter. Today, PAHO Director Dr. Carissa Etienne will give you an update on the current pandemic situation in the region, and specifically she will refer to the border situation and the situation regarding migrants. Dr. Etienne is joined by Dr. Barbosa, Deputy Director at PAHO, Dr. Ciro Ugarte, Director at the Health Emergency Department, Dr. Marcos Espinal, Director of Communicable Diseases Department, and Dr. Silvana Villeri, Deputy Director for Health Emergencies and Management and Incident Management for COVID. And without further ado, I would like to give the floor to Dr. Etienne for her opening remarks. Go ahead.
Good morning, and thank you for joining us today. As of June 15th, there have been more than 3.8 million cases and almost 204,000 deaths from COVID-19 reported in the Americas. We are fast approaching 4 million cases, and the epidemic is still accelerating in the region. Our region is diverse. We have a mosaic of scenarios across and within countries. For example, in the United States, cases and deaths have fallen in some of the hardest hit areas like New York, but are on the rise in Florida and Texas. Currently, the United States accounts for 54% of all cases in the Americas. Brazil has 23% of all cases and 21% of all deaths in our region. And we are not seeing transmission slowing down. That is the cases in almost all countries in Latin America, and a few in the Caribbean are rising. While the majority of infections in the region are reported in big cities where economic inequality and population density fuel transmission, our data show a concerning trend towards high transmission in border areas. In the Caribbean, where most islands have not reported significant increases in COVID-19, we remain concerned about Haiti and the Dominican Republic. Both countries, which share an active border, continue to report a rise in new cases, particularly Haiti. We are witnessing a spike in transmission in the north of Costa Rica, around the border with Nicaragua. French Guiana went from 140 to 1,326 cases only in 1 month, a period that coincides with an increased transmission across its border with the state of Amapá in Brazil, and also with an increase of cases in neighboring countries as Suriname. In addition, there is ongoing transmission in the northern states of Brazil that borders with Guyana and Suriname. Also, in the Amazonian region, where Venezuela, Brazil, and Colombia intersect, and in the borders between Peru, Brazil, and Colombia. But why do borders matter? Well, you see, before COVID-19, these areas were home to vulnerable populations, which often includes indigenous groups, remote communities, and migrants, people who travel frequently for work, family, and in search of new opportunities. Most border towns lack robust health infrastructure, and service quality and access are often low. Due to limited hospital facilities, they often rely on labs of limited capacity and small clinics that serve communities in vast catchment areas. The COVID-19 pandemic accentuates these vulnerabilities, and the increase of transmission in these areas is cause for serious concern and immediate action. To contain the spread of COVID-19 and to protect migrants and other vulnerable populations on the border, countries must work together to strengthen the health response within their territories and across frontiers. We have done it before. Our region has a strong track record of partnerships between countries, even during conflicts and other extraordinary circumstances. Here are several important steps that countries can take to boost the response to COVID-19 on the borders. Strengthen primary healthcare services in border areas, as they are the front line for diagnosis and care. And healthcare workers need adequate training and supplies. The planning of services should take into account local communities as well as transient populations. Emergency facilities and surge personnel will be needed to back up local capacity during the pandemic. The sharing of information across borders is imperative, not just at the national level, but especially at the local level. Border towns often share people, geography, and culture. They also need to share epidemiological data and resources. Surveillance is essential and should be prioritized. This includes boosting testing capacity in remote settings that often lack strong lab infrastructure. We also need to be mindful of cultural barriers by sharing information on how to prevent the spread of COVID-19 through various media forms, channels, and languages that a diverse range of communities can access and understand. PAHO is supporting countries to address the spread of COVID-19 in border areas, either by establishing a local presence or by boosting the capacity of local health authorities. In Leticia, Colombia, we are providing technical assistance and facilitating bilateral communications between Venezuela and its neighbors to address the needs of migrants. We have also enhanced local capacity with field offices in the state of Roraima and other border areas in the Amazon. And we have helped establish protocols for surveillance, and with other UN partners, we are supporting a triage center along the Haiti-Dominican Republic border. In our role as partner and coordinator, we continue to work closely with our member states, UN agencies, and humanitarian organizations on the COVID-19 response throughout the region. We are also providing a vast array of supplies, such as PPEs, medicines, ventilators, and other medical equipment to ensure local communities and migrants who become ill because of COVID-19 receive proper care. All of this is part of our mandate and ultimately exactly what we were set up to do. In the Americas, the COVID-19 pandemic is a regional problem, not merely a country problem. Our ability to work together will determine how quickly we contain this deadly virus and put a stop to the suffering and loss it causes. Now more than ever, we need partnership and cooperation. We need to draw on the solidarity that this region has long enjoyed. We also need solidarity towards the communities most affected by the virus. It truly saddens me that men, women, and children who travel within our region out of basic necessity are met with hate, stigma, and discrimination. These are day laborers, migrants, and people who rely on the informal economy each and every day to survive. They are among the most vulnerable to COVID-19 and the least likely to receive care. We have a responsibility not to leave them behind. Let me be very clear. Stigma and discrimination have no place in our region. Not now, not ever, and especially not amid a pandemic. I count on all member states to uphold these values so together we can beat our common enemy, COVID-19. Thank you. Over.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. Now we are going to answer the questions that we have received via email, and then we'll move on to the chat. You can ask your question through the Q&A button, and we will take them as they are made. And please identify yourself with your name and your media outlet. The first question is related to migrants, and it is the following.
About the situation of Haiti and the impact of that those returning from the Dominican Republic could have in the COVID-19 situation. What is PAHO doing? Dr. Etienne?
Okay, thank you for this question. Of course we are concerned. We have seen a spike of cases in Haiti in the past weeks, as I mentioned earlier. And as we warned before, despite restrictions at the border between Haiti and the Dominican Republic, and according to the latest IOM report, more than 278,000 persons crossed the border between the two countries. Around 113,500 from Haiti to the Dominican Republic, and 164,400 from the Dominican Republic to Haiti, resulting in a net migration towards Haiti of some 51,000 persons. PAHO is working with the Ministry of Health of Haiti and IOM, UNFPA, and UNICEF to increase surveillance at the border between Haiti and the Dominican Republic. Jointly, we provide the returning migrants with information regarding COVID-19 prevention and screening at the Haitian main points of entry to detect suspected cases. As I mentioned before, PAHO also works with partners to plan and set up areas for screening and quarantine centers in various land crossings along the border. In Wanamans, one of the crossings, the surveillance plan consists of some 60 field teams, including rapid response teams and community health workers, 15 supervisors, 2 data analysts, and a call center made up of 2 people. In that same location, more than 13,500 migrants were screened at the border. Among them, 64 suspected cases were identified, And of those, 49 were admitted to the quarantine center, 44 were sampled, and 6 ultimately tested positive for COVID-19 by PCR. Last week, training sessions were conducted for the field teams. Discussions were held by PAHO with the Ministry of Health and UN partners on the implementation of activities and on how to improve testing capacity at the border. PPEs were also distributed to the staff working at the quarantine center in Wanamath, as well as to Coast Guards in Cap Haitien. We, PAHO, remain vigilant of the evolving situation in that particular border. And we are working urgently with Haitian health authorities and other partners. But as I said before, a much broader coalition to address a potential health crisis in this country is needed. Over.
Muchas gracias, doctora Etienne. La siguiente pregunta.
Thank you very much, Dr. Etienne. The next question is asked by Luis Madrigal from Delfino in Costa Rica and Oscar Ugarte Jimenez from Universidad Journal in Costa Rica, who are asking, what is the main concern for PAHO given the situation in the border area between Nicaragua and Costa Rica, and what can governments do to address the pandemic in that area? Oscar is also saying that xenophobic reactions have increased. Dr. Ugarte, thank you very much. The situation along the border, as the director has properly explained, depends on the quality of the health services to provide care to all of the population migrating from one country to the other, be it to stay in that country or to go and come back given the ease of transfer. The first action that we need to implement is to strengthen the health services. First, to be able to diagnose and also detect cases, to implement the quarantine, also the confinement for those people, and provide health and care based on their situation. PAHO has been working in the border area between Costa Rica and Nicaragua with interagency commissions, with the Emergency Commission, and also with the Commission on International Migration and the Office of the High Commissioner of the United Nations for the Refugees. And we are working on a health plan along the border to be able to carry out triage and also isolation, and also to be able to boost the health services in the areas where we provide care, in particular to migrants. Lab tests were provided as well as PPE, and we provided this to the Office of Migration as well as other equipment such as oxygen measuring devices, thermometers, and the general idea is that by strengthening the diagnosis through these systems, mechanisms that I have just mentioned, we would be able to contain transmission or limit transmission from one country to the other, but most of the transmission happens within the countries, and we need to take this as a priority. The doctor has already mentioned this, Dr. Etienne has already mentioned this, to associate the disease to a group of people such as migrants is a source of a stigma. The worst stigma is among those people who test positive to COVID, and instead of boosting the stigma, we need to help them. That is the main idea, because those who feel that they are at risk, they are not going to say that they do have COVID. They are going to hide their symptoms, and if they result in a positive test, they are not going to say it, they are not going to communicate it, and this is negative to all of us. Thank you very much. We have the next question by Jarna from the Dominican Radio.
Exponential rises in COVID-19 cases in the region. Could this be the second wave, or are these countries still grappling with the first? Dr. Barbosa?
Thank you for these questions. This is definitely the first wave. We can only talk about a second wave after the first wave is completely controlled. This is, for instance, the situation that we have now in New Zealand. New Zealand completely interrupt the transmission of COVID-19. So if in 1 month or 2 months, New Zealand experience a new wave of transmission, this will be the second wave. But in Latin America, now we have the first wave. The transmission here started by the end of February, when we had in Latin America the first cases, important cases from Europe, most of them. During the months of March and April, the countries in Latin America adopted very important measures, social distancing measures that were able to reduce the speed of the transmission. But since the last 2 or 3 weeks, we are clearly seeing a trend, and this was the trend that our director mentioned. We are experiencing a very important increase in the number of cases in many countries. This is probably related with the challenges that the Latin America countries with poverty, with informal economy, they are facing to keep their social distancing measures with the efficiency that they need to be implemented. Thank you.
Gracias, Dr. Barbosa.
Thank you, Dr. Barbosa. The next question comes with Mr. Melis from the radio in Brazil, R7 from Brazil. He's saying that several European countries have had very strict measures as of February, but now they are going back to some sort of normalcy. Other countries, such as here in Brazil, we had weaker measures, but the curve continues to increase. Question: will the pandemic take longer here as opposed to Europe? Dr. Espinal, you have the floor. Thank you very much for the question. Comparisons are sensitive. It is not a good idea to compare, since we have different elements. We have Europe, we are comparing Europe. There we have countries that have more resources, but in Latin America we have more inequality, fewer resources, and it is important to take into account all of those aspects before we can forecast the situation. Everything seems to indicate that if the relief measures that are recommended by the organizations, international organizations such as PAHO, WHO, are not adopted or are not continued, the pandemic may take longer as compared to Europe, because this is also going to, as Mr. Barbosa, Dr. Barbosa said at the very beginning, some countries impose some early actions at the very beginning that allow them to slow down the spread of the virus. But now we are in the center of this situation and in the core of the situation, and we need to continue the measures, and this may continue for a significant amount of time. In June, July, according to the models we have, to the modeling, we still see an important wave of the disease. The first one, as Dr. Barbosa mentioned, of COVID cases here in the region. It is important to continue to ask for the measures. Those countries that decided to open up their society need to be innovators, because at the same time, since they open up their economy earlier, that means that we could have some earlier spikes, and that may be requiring more time. Thank you very much. Thank you very much. Now, the next question. We see several journalists that are asking us. Urania Molina from La Prensa Panama, as well as Catalina Logo Herrero from Salud con Lupa, in connection with contact tracing. What is the degree of contact tracing in the region, and do the countries have the resources to do it? And also, what is the impact of weak healthcare systems when tracing contacts for COVID-19. Dr. Alighieri. Thank you very much for those two questions. As to contact tracing, it is key and fundamental in this response to COVID-19, and this is part of case detection, the tracing of the contacts, quarantine, surveillance, and also testing in case of the presentation of symptoms. It is a sequence. As to the implementation of contact tracing activities, that is related to the pre-existence of strong health systems, solid systems, but also the existence of epidemiologic resources on the field so that we can use the tools such as software that would allow us to represent the contact among people. I would like to underscore the existence of a software that is called GoData that has been adapted from a software for other types of diseases and that are being used for COVID. And WHO has published guidelines for contact tracing, and this is information that is being shared with the countries to later implement them in their programs. We have a mosaic of countries, people, but also a mosaic of epidemiological profiles. And I would like to underscore an open list. This is not the full list of countries that have implemented activities for contact tracing, and those activities have been highly efficient. First of all, we have the Eastern Caribbean countries. They were able to have no cases to report for several weeks, but also I would like to highlight Cuba, where the combined activities that included contact tracing and others allowed for a reduction of the incidence rate over the last few weeks, but also Nicaragua in Central America, that due to the implementation of very strong activities through the field epidemiology program was able to lower the curve to better provide services. To conclude, and I could clearly give you more examples, but to conclude, contact tracing is a key activity, and this is part of other activities to reduce the impact of COVID-19 in our societies. Thank you very much. Thank you very much. Now the next question is by Alina Dieste, who is also connected here via chat. And this is from AFP, and her question is,
of State Mike Pompeo publicly demanded PAHO to explain the agency's role in sending Cuban doctors under Brazil's Mais Médicos program. Has the State Department sent a formal request to PAHO about it? If so, what was PAHO's response to this request? Can you please explain how the decision was taken by PAHO? Dr. Etienne?
Thank you for that question. Let me begin by saying that PAHO's relationship with the United States and the American people runs deep. The organization was founded in 1902 by the administration of President Theodore Roosevelt and 10 other countries, and has been based in Washington, D.C. ever since. With the US support and partnerships, we have made the Americas region stronger and safer from health threats, including malaria, Zika, polio, smallpox, measles, And now we are focusing all our efforts on the response to the COVID-19 pandemic. PAHO's engagement with the Mice Medicus program began in 2012 at Brazil's request. The Mice Medicus program provided primary health care to more than 60 million Brazilians, especially Brazilians in remote areas. Brazil saw doctors from several countries around the world, including Cuba. Through the program, PAHO kept member states apprised in regular presentations to its governing bodies. Our role was also the subject of significant oversight and routine audits, which are accessible to member states, including the United States. Nonetheless, PAHO remains committed to addressing all US government concerns to strengthen the organization and to maintain the high confidence of the United States and all member states in PAHO's work. Thank you.
Gracias, doctora Etienne.
Thank you, Dr. Etienne. And I would now like to give the floor
para que haga su pregunta,
to Barbara Fraser for her to ask her question. Barbara, if you can hear us, go ahead.
Sí, gracias.
Yes,
Barbara Fraser, I'm a freelancer based in Lima,
Fraser.
Peru. I'd like to follow up the question of contact tracing. Thanks for the information so far. As countries begin to open up their reopen sectors of their economies again, I'd like to know a little bit more about how they should how contact tracing should be implemented. What kind of testing should be done? Who should be tested? What are the indications that there is an outbreak that needs to be controlled, that might require quarantine measures again? How should they calculate the number of people they need for contact tracing? How many people they actually need on the ground for it? And how likely are apps, the mobile telephone apps, to be helpful? And if they can be helpful, how can they best be used and what are their limitations?
Gracias, Bárbara. Doctor Barbosa, ¿puede tomar esta pregunta?
Thank you, Barbara. Dr. Barbosa, could you answer that question?
Let's see, because you made the 4 or 5 questions. Let's start with the test. Test is PCR. PCR is the test that is recommended to confirm cases. So the test that the countries need to use for this purpose is PCR tests. Second, the number of tests or the method that it needs to be implemented is offering tests to all suspect cases. So if you can offer tests to all suspect cases, and when you confirm a case, you can monitor their contacts and test their contacts. And if one contact test is positive, this contact can be isolated, and you can trace the contacts of this positive contact. You are cutting the way that the virus is transmitted. So this is the methodology that many countries have been successfully applied so far. This is a very important tool when the transmission is declining in a country that is open up in the economy. This is very important to prevent the increase of cases. And you mentioned also apps. Many countries are using apps. They can be useful because these apps, a person can inform the Ministry of Health, the Secretary of Health, these contacts can be easily contacted using cell phones, and that now in our region, many people have cell phones. The number of cases, obviously, it is related to the population. PAHO provided to the countries modeling estimations that supported the countries to make a good estimation about the number of cases that they probably have. But, of course, the idea, again, is that if you want to interrupt the transmission, you need to be able to test every suspect case that you find or that goes to a health service. So this is the way that from this case, tracing and monitoring their contacts, you can interrupt the transmission of the virus. Thank you.
Gracias, doctor.
Thank you, doctor. We have questions from two journalists from Nicaragua, Lidia Lopez from La Prensa, and Ubiel Velázquez from Despacho 505. And their question is, Lydia is asking how effective are detection tests and what is PAHO's assessment regarding the Ministry of Health position of doing testing door to door. And Uriel would like to know whether PAHO has any kind of projections as to when the spike, the peak might occur. Dr. Ugarte? Okay, regarding the question about testing, they have been answered already. However, I would like to highlight the importance of having a diagnostic test for respiratory infections in general and acute respiratory infections in general. We need to identify what the infectious agent is that's causing the infection in order to adequately treat patients. That's why it is so important to have a lab diagnosis, because clinical diagnosis provide guidance on what the initial treatment should be. And those door-to-door visits require highly trained personnel with special skills and knowledge that would enable them to perform give an accurate diagnosis and take appropriate measures. So that personnel should also be protected, because once they are exposed to infectious agents, whichever the agents might be, but more specifically this SARS virus that causes COVID-19, it is necessary for that staff to also take all the necessary precautions, because the etiological diagnosis can come much later, and exposure can make our staff be quarantined or isolated depending on their condition. On the other hand, that diagnostic test, especially in situations such as this pandemic, helped us to determine the transmission status of this virus. And we're talking about the virus because to the extent that we can detect virus presence in other areas or in other health facilities or clinics where there are people receiving other forms of care, is the same extent to which we will be able to take additional measures such as physical distancing, but also isolation, quarantine, etc. And there's also something very important, and that is that if we do not have an etiological diagnosis, we will not be able to know how the pandemic is going. So, regarding the question as to whether or not we reach the peak in any given country, well, that can only be answered if we do the appropriate diagnosis. Clinical diagnosis is helpful only if the staff is highly trained and skilled in diagnosing the disease and has a way of saving the lives of the people who test positive. Thank you, doctor. The next question is from Valeria Heredia from El Comercio paper in Ecuador. The question is, are intensive care units important during this COVID-19 pandemic? What is the hospital bed ratio that should be in place in countries such as Ecuador, and what are PAHO's recommendations in this regard? Dr. Espinal, go ahead.
Si puede unmute.
Doctor, you are muted. Could you please unmute your mic? My apologies. Thank you very much, Valeria, for your question. The important thing is not to see the hospital bed ratio, but rather how we manage the beds that we do have available in any given country. PAHO recommends several things in this regard. First, to centralize the management of all beds that are available, not only in public hospitals, but others like just private sector, social security, armed forces, etc., because that way we will be able to manage mobility. Let us remember that not all provinces, for example, in the case of Ecuador, have the same rate of incidence and mortality. For example, what we saw in Guayas. So it is very important to have very good management and to have that centralized, because during a pandemic, we have to operate differently than in times of peace, let's say. That's on the one hand. On the other hand, we need to have a monitoring system for that bed management system, almost on a real time basis, to be able to take action and make the necessary adjustments. At the same time, we need coordination between the National Health Services Network and the medical emergency teams, which need to coordinate themselves in order to appropriately manage these beds. Each country will have their number of beds, and let's say there are 3,000 beds available plus an additional 600 or 700 beds for intensive care units. But it's important to centralize their management, like I said, to coordinate not only what happens with the public hospital network, but also with other sectors of the country. Thank you.
Varias preguntas de
Thank you,
Chile.
Doctor. We have several questions from journalists in Chile. We have several of them that are sending them via the chat. I'm going to try to group them together, but Andrea Cobay from ADN Radio, Rocío La Torre from La Tercera, and Pablo Cádiz Pozo from T13 in Chile would like to know what PAHO's position is regarding Chile and the strategy the country has adopted, also the measures that should be taken, as well as the deaths that the Ministry of Health Department of Statistics has reported to the WHO. Dr. Barbosa, can you ask him? Yes, Chile is in the same situation as other countries in South America. That is to say, over the past 2 or 3 weeks, it has seen an increase in transmission rates, which has resulted in a significant increase in the number of cases. It is also worth mentioning that Chile has implemented from the very beginning a very aggressive strategy, and it expanded the access to PCR tests. So it's only natural for Chile to test higher than other countries in South America. So there's greater access to PCR tests. So all the indicators show that in Chile, Brazil, Peru, Argentina, and all of the countries in South America, due to different reasons, are in a period where there's an increase in transmission. Chile has implemented this dynamic quarantine strategy at the beginning where they had low transmission rates, and they basically focus on social distancing by district, by areas, and limiting economic activity. Now, over the past 2 weeks, there has been an increase in transmissions, and therefore the Ministry of Health in Chile changed its strategy, and it adopted similar strategies to what the other countries adopted, which had to do with social distancing in all of the country, with the expectation we all have that that will lead to a reduction in transmission rates. Now, as far as the number of deaths to the World Health Organization and Pan American Health Organizations, countries report the number of deaths that have been confirmed as well as the number of confirmed cases. Now, some countries also report within the countries for the purposes of transparency and for the academia to be able to follow up on the cases, all suspected cases and suspected deaths and probable deaths. Now, what's the difference? Well, oftentimes a person gets to the hospital, takes a test, they confirm that it is a COVID-19 case, and that person unfortunately dies about 2 weeks later. Now, that is considered a confirmed death for COVID-19. Now, there are other people that get to the hospital in critical state, gets tested, the person dies before we get the results. So that is considered a suspected or probable death, depending on the condition, until the final PCR test results arrive. If the test is positive, it is considered a confirmed death, and the information is reported. And if it is negative, then the case is discarded. So both PAHO and the WHO receive that information, and we are being very transparent. On the PAHO website, you can see the number of confirmed cases and confirmed deaths due to COVID-19 by country, Chile included. Thank you. Thank you, Doctor. And our next question is from Gisela Salomon at the IP. The question is, are there other concerns because of the upcoming winter season in the southern cone? Have you seen colder weather having an impact on the virus transmission or not? Dr. Aguirre, could you please answer this question? Yes, thank you for that question. I believe this has been one of the core topics during last week's press conference.
El cambio de temporada puede llevar riesgos de estación, quiero decir. Los países del Cono Sur sabemos que
changing seasons can carry certain challenges. We know that the winter season is also an influenza season, and we are concerned because of this flu season coming up. We know that in the past, the impact of the flu cases and serious flu cases in the intensive care units was significant. And so we're talking about the potential arrival of severe system to a health system that is already strained because of COVID-19. That's to begin with. Second, in terms of surveillance of feverish patients with respiratory conditions can become even more complicated in this case, not only because of COVID, but also influenza and other respiratory viruses. And that is why PAHO has recommended that countries very strictly implement their vaccines in risk groups, more specifically flu vaccines. And finally, my last comment is that the whole dynamic around COVID-19 is yet unknown to us. So we are in this learning phase from the point of view of both science and epidemiology. So we need to strengthen our surveillance systems in order to better understand how this SARS-CoV-2 behaves. And the disease it causes COVID-19 during the winter season. Thank you.
Gracias, doctor. La próxima pregunta nos viene.
Thank you very much. Now we have the next question by Isabela González from La Reforma, Mexico. The question is, what is the information in connection with migrants, and what happens between the share border between Mexico and the US and the border with Guatemala? Also, what have you detected in both borders? Dr. Ugarte. As to the border between Mexico and the US, that is a high movement border, but we have seen a constant flow of people going back to Mexico because of them wanting to go back, but also because we have some cases of forced returns, and we do have protocols for the management and prevention of cases, but this is highly difficult because of the lack of trained staff. And together with the International Committee of the Red Cross, UN agencies, and other agencies, we have been training staff so that we can, and I am referring to trained staff, to be able to detect and implement protocols that include quarantine at the border. Even though there is a large amount of unconfirmed information regarding positive cases of COVID for those people arriving from the northern border to Mexico, we do need more information in connection with the number of cases. We do not have enough information for a proper diagnosis, and here we have the call by our director to increase surveillance at the border to better respond from a medical point of view. As to the southern border, we have been working with, I am referring to the border between Guatemala and Mexico. We have also been working with NGOs and UN agencies, NGOs that do have a presence in those states, and we have boosted the number of people, medical staff at the border, and we have also deployed medical staff for the detection in the community since they cross the border and they become part of the society. The main issue is that we need to have more adequate information as to diagnosis and also the availability of the health services, not only to serve those cases that were detected among migrants, but also to strengthen the care capability for people in the border area. And in all cases, this is a population that has fewer resources than in the central areas of the country. Thank you very much. This is the last stage of this press conference. We still have some questions. The next question comes from Angel Bermudez from BBC World. He's asking, how do you explain that in spite of the fact that Latin America had such a long time to get prepared, the region is now the epicenter of the pandemic? Mr. Barbosa, could you please address this question? Yes. Latin America prepared for the pandemic and adopted important measures that were able to establish a transmission for several weeks, whereby we did not have an explosion of cases in Latin America, as we saw in some areas of Italy, and also here in some areas of the US, such as in New York. The measures implemented in Latin America are important, are significant to avoid overwhelming the healthcare services. Decisions were made, but in many cases, the decisions were made so as to avoid having problems with access to ICUs. But this is an area with a high index of poverty and informal economy that cannot be compared to Europe or other neighboring countries. And also, to maintain these measures for an extended period of time, we have a very significant challenge. So, as always, we need some sort of social protection measures and also economic and social measures that can make sure that poor populations in Latin America can observe social distancing policies. Otherwise, it is going to be very difficult. These are persons that need to go out to buy food on a daily basis because they do not have a fridge at home, they do not have any formal job, so they have no social protection. We are seeing a situation that, in my opinion, is more related to the social determinants of the region than the preparation of a health service or system. Thank you very much. Thank you, Dr. Barbosa. The next question is by Susana Correa from O Globo, Brazil. Her question is,
of Brazil reopening the economy while COVID-19 curve is still growing here? And also, should countries in America open borders in the near future for Brazilians, even though disease curve is far from flattening? Doctor Espinal, ¿podría tomar esta pregunta?
Yeah, thank you very much for the question. The recommendation of PAHO is that the package of measures that has been recommended continues to be implemented, or and even strengthening them, because we are in the middle of the epicenter. Basically, is our region, and what we have seen is increases in not only in Brazil but in various other countries across the region. I think it's important to say also that every country is sovereign and they decide whenever they want to open or reopen. The recommendation is that if the decision is to reopen, that it should be slowly, by phases, and to ensure that a system is in place to test and also to detect and trace contacts of these people, to isolate them, because that would be the main action to cut the chain of transmission of the virus. But also implementation of non-pharmaceutical measures are critical and important. And it doesn't have to be necessarily a full lockdown. It could be a neighborhood, it could be a town, it could be not 24 hours or so. Innovation is important here. I mean, reopening borders is a decision of every country, and the important issue is that I think is the epidemic has not yet passed its peak in Latin America, and we're still in the middle of it, and we need to continue ensuring mitigation actions are implemented across our nations. Thank you.
Gracias, doctor. Siguiente pregunta.
Thank you very much. Next question. This is a question by two journalists related to Venezuela. And this is Isagen Herrera from the New York Times and also Alberto de Rivera from Assagi's in Brazil. Isagen is saying that Venezuelan experts are asserting that Venezuela is going into an exponential transmission rate, but the government continues to ease out the measures. What do you think of the way the country is addressing the situation? And Alberto is asking about PAHO's opinion in connection with the official number reported in Venezuela, and also as to testing and confirmed cases. What is our opinion? Dr. Ugarte. The situation in Venezuela continues to be a cause of concern, and there is enough information to be able to analyze the situation. And we have also been working with the Ministry of Health and the national authorities to be able to conduct analysis and also to act in some priority areas. It is true that in general there is a large number of cases that are impossible to determine as to the causative agent, that is to say, the agent causing this acute respiratory infection. And this is the norm in cases of pandemics. Whenever we find a clinical case that is compatible, we can associate those cases to COVID, but many of those cases may end up not being COVID. So the accurate number, or even the approximate number, whenever the surveillance system and the diagnostics systems are not properly established, is quite difficult. Given this context, easing out the social distancing measures or the reopening of the economy should take into account the epidemiological data and also the review of the data on hospital beds and ICU, and this has to be done progressively and also in specific areas where one has the possibility to properly carry out surveillance, and also based on the interaction that we have had with the various groups, that is the official groups of the government and the interaction that we have had with other groups, we see caution behind these measures, that they are being followed with caution. And once we see that those measures are leading to a spike in cases. I'm certain that they are going to be adjusted, and this is to be applied to Venezuela, but also to all of the other countries, as my colleagues have previously indicated. The diagnosis of the virus situation is the most important aspect, and in that regard, it is basically the cornerstone to be able to determine the actions that may be implemented in terms of social distancing or the reduction of those measures. Thank you. Thank you, Doctor. And now we are going to move on to the last question by Sebastian Boyd from Bloomberg.
Latin America tend to be more exposed to risk factors such as overcrowding, informal employment, and limited access to healthcare systems or social support. Does PAHO have any data to show whether the virus is having more impact in immigrant communities? Y otra pregunta que también recibimos.
This and another question that we just received is the following.
To strengthen the response in the borders, but what about the migrants that are stuck or in transit due to COVID-19? Dr. Etienne?
Thank you for those two questions. Let me begin by saying, first of all, we have been working with countries in our region to support the response for migrants well before COVID-19. The pandemic, of course, has added a new level of complexity to that cooperation. Yes, and it has definitely made it worse for migrants living in temporary settlements or in the process of migrating, where access to healthcare services is very often limited. PAHO is well aware of this situation, and we are calling countries to take this situation into account in their response. PAHO is working closely with countries throughout the region to implement these recommendations and to bolster our health response in border areas. So let me just give you a flavor of the work that we are doing in this respect. As I said before, our country teams have been working with the governments of Haiti and the Dominican Republic to monitor the health of returning migrants by supporting screening and contact tracing measures, and by helping to set up quarantine centers in some areas of Haiti. We've also had an active role in facilitating bilateral coordination between the Colombian and Venezuelan health authorities to formulate strategies to protect the health of border populations. On the border between Colombia and Brazil, PAHO carried out a joint technical mission with the Ministry of Health in Leticia, Amazonas State, to help local authorities develop a contingency plan. We also distributed PPEs, medicines, ventilators, and other medical equipment to ensure local communities and migrants who are ill with COVID receive proper care. In some Brazilian border states, for instance, PAHO is training healthcare workers in case management and infection prevention and control, as well as on outbreak investigation and contact tracing. We have also worked to ensure local mental health support is adjusted to the realities of COVID-19 and migration, including risk communication and the dissemination of communication materials on stigma, mental health care for the elderly, and healthcare professionals. These are just a few examples of our work in the field. But what I believe is that our main role, still being in the unique position that we are, is to bring all the parts together across borders to protect our people in the region and to ensure that migrants have access to the information and care that they need, free of stigma or discrimination. I believe that PAHO is uniquely placed to do this, and we will continue to work with all of our countries and with the border communities to ensure that we bring healthcare that is specific to COVID-19 to them. Let me thank you again for being here with us today, and we hope to see you next week. Thank you.
Muchas gracias, doctora Etienne, y a todos por conectarse.
Thank you very much. Thank you very much, Dr. Etienne, and thank you all for participating. We will be sending you the opening remarks by the director as well as the recording of the session, and you can continue to communicate with us via email, and we will be addressing your questions as soon as possible. Thank you very much, and we'll be in contact. Thank you very much. Greetings. We'll be addressing your questions as soon as possible. Thank you very much, and we'll be in contact. Thank you very much. Greetings.